but that can either bind or block folate from getting into the brain. It's positive in about 75% of kids with autism. So most kids with autism have low folate in the brain, and that's definitely contributing to some of the core symptoms. So basically we test for that. We put them on high dose folinic acid, not folate, or not folic acid, which is synthetic. And we see big gains in a lot of kids, and my son was certainly one of them with this treatment. So, so definitely something to look at. Another thing that we wanted to mention is GI dysfunction. So there's oftentimes, there's a study that showed that the kids on the spectrum have intestinal permeability at 43%. So almost half of them have what we know as leaky gut, and none in the controls. So definitely there's a lot of intestinal permeability. And interestingly, in another study, it showed that the kids with autism had 36% intestinal permeability, and their relatives, namely their parents, had 20% compared to 4.8% control. So what it means is that we suspect that they're inheriting their microbiome from their parents, and their parents often have leaky gut. And this is part of why they have immune dysfunction even before they're born. So really looking at the parents is a big part of, you know, prenatally, how is your intestinal permeability doing? You know, how is your microbiome? And so that's, again, a whole other talk I've done before, but very important. And so another thing we see often with, specifically with autism, is that the #1 comorbidity with autism is constipation. So these kids, there was a study that showed that 36% have significant constipation versus 10% of controls. And consumption of milk was a big part of this. So when a lot of these kids, when they drink milk, their bowels just shut down. And we see it over and over again, and then they obviously stop detoxing. We need to have daily bowel movements. And so it's a large part of our discussion is making sure that they are modifying diet and having regular bowel movements. This, I might not show it very well, but basically this means that the stool's all the way up. If you see the kind of white fluffy clouds, that's actually stool. It should be relatively black and clear. And so the stool's literally up past this child's ribs, and this was a patient of ours. And the parents were saying he was having a daily bowel movement. So even when they're having a daily bowel movement, it may actually be backed up several days, weeks. And obviously this kid was not a happy camper.